Next, you are going to assess the infant's abdomen. You're expecting it for its size and shape. It should be symmetrical. The abdomen should be soft and it should be round. You should see the abdomen rising in synchrony with the diaphragm, and you should see no visible herniations. You're going to auscultate in all 4 quadrants for present bowel sounds and also to rule out obstruction. Next, you're going to percuss all regions of the abdomen. It should be resonant over the bowel, and it should be dull over in the right upper quadrant over the region of the liver, and also over the symphysis pubis if the bladder is distended. Next, you're going to palpate the abdomen to rule out any umbilical or inguinal hernias. And also for any organomegaly, or if the abdomen is found to be hard, that could indicate an obstruction. Next, you're going to assess the musculoskeletal system. You're looking for symmetry of movement on both sides of the body. And also you should be palpating all the major joints for any crepitus. You are going to make sure that the ankles have full range of motion, and that the feet return to neutral position midline on their own. You are going to perform Ortolani's maneuver, in which you are going to lay the infant supine flat on the examination table. You are going to have their knees and hips flexed at 90 degrees. You're going to have your middle fingers on the great trochanters and your thumbs on the inner thigh, and you are going to gently abduct the hips while applying upward pressure, and you should be hearing no clicking. Then to do Barlow's maneuver, you're going to hold that position and then apply downward pressure while adducting the hips, and you should see that the head of the femur remains in the acetabulum. Next, you're going to assess the neurological system, which a lot of your other assessments are indicative of the neurological status of the infant. Basically, you're looking for obvious signs of head or spinal abnormalities visually. You're looking for different abnormal signs and symptoms such as persistence or absence of normal reflexes, any involuntary movements. You're looking for an absence of the blink reflex or any abnormal posturing. Next, you're going to inspect the genitalia for a female. You're going to visually inspect the vaginal opening. It should be present, it should be not have any drainage, and there should be no odor. You can go ahead and let the parents know that if they see any light spotting in the diaper, that could be normal, and that it's also normal for the labia to be enlarged for the female. For the male, you're basically making sure that the urethra is midline, and that the testes are fully distended, and that there's no lesions or edema. Next, you're going to assess the anus and the rectum, which is not routinely done unless there are issues, but basically you're just looking for it to be well formed, and that there's no redness or bleeding. And that is the end of the infant assessment.